Hello and welcome back. So, in this part of the lecture, we will discuss about what are the guidelines to perform cervical cancer screening, what are the different tests which women should have it, and we will talk in context of the United Arab Emirates. We have guidelines from the Ministry of Health, and there are guidelines by the Department of Health in Abu Dhabi. They are actually the same. Literally, they are the same. Okay. So please remember that in every country, the starting age for cervical cancer screening that's different. For example, in the USA, they start it at the age of 21. In the UK, they start from the age of 25. In the UAE, again, we start from the age of 25. The only difference is here in the UAE, we have to make sure the woman has had, um, she has been sexually active um, before we do this test, because it needs, of course, speculum examination. So it specifically says all sexually active women, symptom free, aged 25 to 65, either they should be either married or like they should have been sexually active, divorced or widowed, right? In simple terms, it just means being sexually active before, or currently or before, it does not matter. Residing in the UAE are eligible criteria for screening, because these are the UAE guidelines, so of course, that's why they say it. So, what do we mean by it? So, we start from the age of 25 up till until the age of 65. Are excluded from screening if they have received a total hysterectomy for benign indications. Okay. So, and if they're over 65 years, provided that the last two previous smears were negative. Women who have had subtotal hysterectomy, which means the cervix was not removed, or hysterectomy due to cervical cancer or precancerous condition, should continue to have cervical screening. So if there is cervix already there, and then of course they need to continue it, or even if they had a total hysterectomy, but the reason for the total hysterectomy was disease in the cervix. Okay, they should continue to have cervical screening. So what does that mean? That even if the cervix was removed, there will be vaginal vault, right? So we have to take cells from there. Okay. So how frequently it should be performed? Now see, every 3 years for women aged 25 to 29 years, and from 30 to 65 years, it should be 5 yearly. But there is a catch here. Okay. So there are different methods of testing. Okay. So we will talk about it. Just remember that they say 3 yearly for up till 30, and after 30 to 65, it should be 5 yearly. But there is a condition related to it. Okay. And I'll come back to that later. And yeah, one more thing. So women who are immunocompromised, for example, HIV, they're immunocompromised women, right? They need to have annual screening. Okay. Instead of this 3 yearly or 5 year, they need to have annual screening. So, which test to perform? See, there are actually three different methods of testing, which we will discuss in another slide. But women aged 25 to 29 should get a PAP test every 3 years. Like, PAP test basically means you can even do it by a liquid based cytology, and then the cells are examined under a microscope. Okay. And then women after 30, it's called a co-test. Co-test means they need to do two tests. One is this cytology, and the other one is HPV. Okay, so HPV testing plus this cytology. And if this co-test is performed, then it needs to be 5 yearly. Okay, why? Because this HPV testing, it is actually the best test. Okay, the best test to have is the HPV test, but it is performed after 30. Now, why after 30 only it is performed? Because before 30, a lot of women, they have HPV, usually the benign, the low risk ones, right? And it can just add to anxiety. Okay, so that's why it's performed after 30. And why 5 yearly? Because it can detect very early cellular changes, very early precancerous changes. So if HPV testing is negative, the woman is safe for 5 years. Okay, so that's the reason. Now, this is an actual report from a patient, and I have removed the patient details from there. So see, I usually in lectures I tell you though that when you are talking like to a patient, it's okay to say pap smear, but when you are presenting or something, just say cervical cytology. So here you will see even this sample, like I had taken liquid-based cytology. Okay, the method is the same. You just use a cyto brush and send it in a bottle, and then see, then they say received one container for liquid-based cytology process, and out of that bottle, which had cells from the cervix, from the transformation zone, then they prepare it stained, and then they visualize. So one pap stained smear is prepared. So they prepared a smear. Okay. So, and I want to tell you one thing here. The first thing they see, even before analyzing it, is whether it is adequate or not. What does that mean? It should be taken from the transformation zone. Okay, so they specifically in every cervical screening report, they mention this, that endocervical transformation zone component is present, and then it is considered adequate, and then they analyze it. So what is the main interpretation? That's our main area, right? That's the main thing we need to know. Negative for intraepithelial lesion, like precancerous thing or malignancy. So there is no a pre-malignant or malignant thing. So there is nothing. Okay, it's a normal report. And then reporting system. So remember this, you do not need to go into details, but there is a system for classification of cervical cytology that's called Bethesda system. Okay, so they will always mention that this system is, or whatever system is used, they will mention that Bethesda system. But here you just quickly look at the interpretation. If it's negative, well and good. Okay. So now this is again from the Ministry of Health guidelines. You do not need to go into a lot of details, but I know some of you, you may be interested in knowing more. So see, 25 to 29 years old only smear, which is like the liquid-based cytology, right? Or call it pap smear, that's fine. And then it can be anything, right? It can be negative, it can be abnormal squamous cells of undetermined significance. Okay, and then it can be a low grade lesion or a high grade lesion. Okay, and for 30 years old, what this you have to remember that it should be a co-test. And remember, what did we mean by co-test? Co-test means this liquid based cytology or a pap smear plus HPV. Okay, and then it is interpreted depending on that, right? Is it like negative smear and HPV? Is it positive smear and negative HPV, or is it positive HPV? Okay, and if it's positive HPV, it depends whether they are high risk or what type, the low risk. Okay, so and then it is further managed. I do not want you to remember any of these details. Just remember this: 25 to 30, what is the test done? 30 onwards, what is the test done? That's it. Okay, now this is the American guidelines. You do not, of course, need to remember all of this. Just remember that they start at the age of 21. Okay, under 21, no screening is recommended. So that means, see, if even in history taking in the UAE, if it's a less than 25 years of age, you do not need to ask about cervical screening. It's just waste of time, right? You will only ask about did you ever had a cervical screening and when was it and what was the result like, only in women who are more than 25. But of course, it will change when you move to another country. Okay. So here again, they say more than 65 years, no cervical cancer screening required if the woman has had regular screening in the previous 10 years and no serious precancer in the last 20 years or whatsoever. So every country have their own guidelines. I do not want you to remember this slide as well. Okay. Now, what are the different methods of cervical screening? Of course, it needs all of them. They need cervical this speculum examination. All of them they need taking a sample by a cytobrush from the transformation zone. Okay, and what is the transformation zone? Just a revision, it's the area where the endocervical epithelium, the endocervical epithelium and the squamous epithelium, they meet and there are changes there. Okay, secondary to estrogen. So all methods need a speculum examination by a doctor or a nurse. It does not matter, and collection of sample from the transformation of zone of cervix. Yeah, just to remind you, in many countries, it's the general practitioner who performs cervical screening. Okay, So it's the duty of the family physician or the general practitioner. But I know in the UAE, it's the gynecologist who does it. Okay. So don't be surprised if you are a family physician and everyone expects you to perform it. So remember that when cells are taken, so what was this report? Is it histology or is it histopathology or cytology? See, it is cytology because they are looking at the cells. So it's cytology. It's not histopathology. Histopathology is performed on the tissues, right? When biopsy is taken. So it's not biopsy, okay? It's cytology, cytological examination. So first is pap smear, where the on a slide a smear is made, then liquid-based cytology, where taking sample is the same. It's just put it in a liquid bottle like we have done, and then send it to the laboratory, and they look at it under a microscope. And then the third one is on the same sample, the sample we took in a bottle, HPV DNA testing. Okay, so it is the best method, HPV DNA, but the problem is, especially when it's an insurance based system, it's expensive. So insurance people usually do not, until and unless it's a very good insurance coverage, then they usually do not do not let us perform HPV DNA testing. Okay, so usually insurance people, they do not approve it initially. So they approve either this pap smear or liquid based cytology first. So, okay, so what is the precursor lesion of cervical cancer? That's cervical intraepithelial neoplasia or CIN. Do you remember endometrial hyperplasia lecture? So we said what is the precursor lesion for endometrial cancer? That was endometrial hyperplasia. Okay, so that comes first and then it changes. So same as here, it's CIN, cervical intraepithelial neoplasia. Now, in different classification systems, it is defined differently. Okay, so in CIN 1 is equal to mild dysplasia, and it is also equivalent to low grade squamous intraepithelial lesion. Okay, low grade lesion. CIN 2 is moderate and it is high grade. Okay, and CIN 3 is severe dysplasia. And again, so it's from CIN 2 onwards, it's high grade, high grade, high grade, and then there is carcinoma in situ. So only CIN 1 is mild dysplasia, which is the low grade lesion. Okay, so there are different methods of classification, but remember that. Okay, so CIN 1 means low grade lesion, CIN 2 onwards means it's high grade lesion. Okay, so what does that mean basically? A CIN is histopathology. Why histopathology? I know a lot of people are confused by it, but see, because in CIN 1, how it is defined, it is the presence of atypical cells in less than one third of the thickness of epithelium. So if see, this is one less than one third of the thickness of the whole epithelium. And when we are taking, say, for example, pap smear or liquid-based cytology, we are not taking the whole tissue, right? We are just taking cells. So on cytological examination, we should not say CIN, but when we take a biopsy, then because the histopathologist can see they have tissue, right? Not only cells. So they can label them either CIN 1 or CIN 2 or CIN 3. So CIN 2 is involvement of one third to two third of the thickness of epithelium by abnormal cells, and CIN 3 is the of whole thickness, okay? Whole thickness of the epithelium by atypical cells. And what do we mean by carcinoma in situ? Okay, what do we mean? So what is the difference? So what is the main difference, say for example, between CIN 3 and carcinoma in situ or carcinoma? It disrupts it breaches the basement membrane. Okay, so this disruption of basement membrane, that makes a difference. Okay, now why having CIN 2 and CIN 3 is bad compared to having CIN 1? See, it takes many years. It does not happen in 1 year from precancerous lesions to cancer. It may take many years, 10, 15 years, who knows, right? It does not happen in a couple of months or a couple of years even. Okay.